all stakeholders realized pretty quickly just how underprepared we are and just how much is possible when we work together. And that the individual actions of any government or company won't add up to a proper global response. I think if we're honest with ourselves, collectively, the international community has never done enough to respond to global health security challenges. That we knew before COVID that the world was underprepared for biological risk. When we walked into the room in New York, if you would have asked, do you think the world is prepared for a pandemic? I think everyone around that table would have said no. But it's when they walked out, I think it's when we really knew that if we are going to get ready, we need to have operationalized and integrated public-private cooperation that we haven't seen before.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died. Experts agree, unless it is quickly controlled, it could lead to a severe pandemic. It could lead to a severe pandemic. It could lead to a severe pandemic, an outbreak that circles the globe and affects people everywhere.
The mission of the Pandemic Emergency Board is to provide recommendations to deal with the major global challenges arising in response to an unfolding pandemic. The board is comprised of highly experienced leaders from business, public health, and civil society.
We could be looking at double the number of cases in 1 week and 16 times as many in a month if we are not able to stop the spread. That would be on the order of 500,000 cases, and it would continue to rise exponentially. In 3 months, we could be approaching 10 million cases.
We're at the start of what's looking like it will be a severe pandemic. And there are problems emerging that can only be solved by global business and governments working together.
We have known about CAPS-like viruses in animals and people for decades, but have not been successful at developing a licensed vaccine. And sure, there are new technologies that may help, but it's going to be difficult. I am not optimistic about having a vaccine in time to be relevant during this pandemic.
So the policy crisis in question for this board in this meeting is this: how should governments, business, and international organizations allocate and distribute pandemic antivirals and medical supplies to the people who need them most?
What we've seen work very well in the HIV field is, in fact, procurement through the Global Fund. So having a centralized mechanism, so financially able to procure on behalf of affected countries would be critical. I think the second thing is it's going to be very important that for the business sector, for manufacturers of antivirals, that we have clarity around what the need is and where the need is and who are making the decisions.
I think that given that the countries most affected are those that are low and middle income countries with unequal access to technology, to finances, the UN has a worldwide footprint, universally recognized, and universal membership.
A global stockpile would certainly help ensure more rational and strategic allocation, but the reality is that we don't have the logistics capability, even within the UN, to bring that together in one place and run it. So this is where I think a collaboration between the international organizations like the World Health Organization and the private sector, which runs these supply chains for many purposes every day, understand where the supplies are, make smart decisions about how to allocate them to the people who need them in the places that need them the most, and then work with the industry to move those supplies from where they are today to where they need to be.
Just to underscore the point that cooperation among supply chain providers or businesses that have huge supply chains can add a lot of efficiency to the whole process.
The question is, can you, through this international mechanism,